Fact number 1. ACL injury happens in sports, which involves cutting, pivoting, twisting, and jumping activities. Sports like football, badminton, tennis, basketball, skiing, and athletics has high incidence of ACL tears. Non-contact ACL injuries are 8 to 10 times more common in females than in males. This increase in incidence starts immediately after puberty. There are many reasons for the increase in ACL tear in female sportspersons. Hormonal factors, anatomical factors, genetic factors, and neuromuscular factors all play a role in this. Increase in hormones like estrogen and relaxin, increased Q angle, small size ACL, weak hamstrings, and dominant quadriceps muscles are the reasons for the high incidence of ACL tear in females compared to males. There are many preventive programs available which help in reducing the ACL injury rates in female sportspersons. All these programs improve jumping and landing mechanics by strengthening weak hamstring and hip muscles. Fact number 2. Arthritis is a condition which involves damage and degeneration of the protective sponge layer called as cartilage layer that covers all big joints. There are many causes of arthritis like osteoarthritis, rheumatoid arthritis, gouty arthritis, tuberculous arthritis, traumatic arthritis, etc. Any trauma to the knee joint, especially trauma that causes instability to the knee, will eventually damage the protective cartilage layer and result in knee joint arthritis. The most common injury which causes instability is ACL tear. Therefore, arthritis will always result after an ACL tear. Other associated injuries, like meniscus tear, will speed up the degeneration and damage of the cartilage layer if left untreated. Following ACL surgery, the incidence of osteoarthritis is decreased compared to untreated ACL tears. In 10 years after ACL tears, 25%, and in 20 years, 50% people will develop osteoarthritis of the knee joint. Fact number 3. All ligaments have the capacity to heal naturally, however, a complete ACL tear will not heal by itself. The reason for this is the presence of normal synovial fluid in the knee. The joint fluid 3 to 5 milliliters normally helps in nourishing the cartilage layer, has substances which prevent blood clot formation within the joint. This is a protective mechanism as blood clot formation results in scar formation and stiffness in the joint. The drawback of this is, without blood clot formation, the healing process does not progress further and stops. Therefore, ACL tears does not heal naturally due to presence of blood clot breaking substances within the synovial fluid. However, partial ACL tear may heal. Fact number 4. Cartilage injuries or injuries to other ligaments like MCL and PCL are also frequently seen together with ACL tears. These are very severe injuries and require urgent surgeries. Most of the times ACL tear are isolated injuries, but sometimes there may be injury to other joint structures. Normal knee joint has 4 ligaments: the ACL, the PCL, the LCL, and the MCL, the cartilage layer, and the 2 meniscus. Usually, lateral or outer meniscus tears are common at the time of ACL injury, and medial or inner meniscus tears are common after few months of an untreated ACL injury. Fact number 5. Ligaments in our body work like a spring. They become hard and short when twisted, and lengthen when untwisted. And they always try to recoil back to their original position. This spring mechanism is very important in joint stability and walking. When we stand and make our legs straight, the ligaments of our joints twist and shorten. This brings both the joint bones tightly together and locks the joint. Once the joint is locked, the leg becomes stiff, which helps in standing and putting our weight on it to swing our body in forward direction. Similarly, when the leg has to be folded, the joint unlocks by untwisting of the ligaments. The joint bones loosen and can now be folded to move the leg forward. Therefore, all ligaments of the leg, including the ACL ligament, not only keeps the joint stable during walking, running, jumping, etc., but also help in locking unlocking of the joint, whenever needed, to move or walk. Without ACL and other ligaments of the leg, our joints would not be stable, or we would keep falling down, and never be able to stand or walk.